Hi, I'm Dr. Kevin Kirk, an orthopedic surgeon here at TSAOG Orthopedics and Spine. Cystic fibrosis is a genetic disease that affects about 40,000 Americans. It affects the lungs, the pancreas, and your digestive system. What happens with CF is that the channels in your body make thick mucus, which clogs up your lungs, which predisposes you to respiratory infections. It also can block your ducts in your pancreas and your gut that makes absorbing food difficult. I'm part of the Cystic Fibrosis Foundation because my son Andrew has cystic fibrosis. When Andrew was born in 1997, it was pretty dire. The life expectancy of a child born at that point in time was probably in the early 30s. And so we were really saddened because he seemed to have a little bit rougher course, particularly early on in life, in which he required IV antibiotics at least once or twice a year, with hospitalizations for about 2 weeks at a time. And then there's the daily respiratory treatments to kind of keep the lungs moving forward to kind of prevent that mucus buildup. But with some of the newer medicines that have come out over the last 4 to 5 years, it's significantly changed his life. His pulmonary function tests have improved almost to completely normal. And so this money that we raise through the Cystic Fibrosis Foundation really buys the science, that buys these medicines. And so the course of a child that is born with cystic fibrosis now will be significantly different than Andrew's. However, unfortunately, there's 10% of the people that don't have that hope that was given by the research done through the Cystic Fibrosis Foundation, and that none of these therapies truly work for them. However, with the funds we raise, we can continue to fund the research that has these novel therapies, even gene therapy and other medications that can help this 10% that nothing seems to help at this point. The Cystic Fibrosis Tower Climb is one of the premier events for the Lone Star chapter of the Cystic Fibrosis Foundation. It's 952 steps and 75 floors in the Tower of Americas here in San Antonio. I'm proud to say this year that TSAOG Orthopedics and Spine is the presenting sponsor for the CF Tower Climb. There's really two ways in which you can participate. One is go to fightcf.cff.org and sign up to be a team member or team climber. The other is to just donate money directly to a climber on one of the teams. But really, it's about raising the money, raising the funds that fund this research that really makes a tremendous difference, not only in my son's life, but in others that have cystic fibrosis. And remember, we still have that 10% that don't have a cure option. I'm positive that the money we raise will be used to advance more drug development, but also to finally find a cure for cystic fibrosis.